On the other hand, ICU beds are few and far between in Arkansas, even with the addition of 18 from Baptist Health. People over at Comm say they're still having problems finding beds to put patients into.
Our Jessica Rank joins us live at MIMS, where Comm is located. So, Jessica, what's the situation over there? I would imagine right now they're being inundated.
Yeah, Kevin, well, Comm, the employees here really work behind the scenes when a hospital doesn't have enough space for a patient. It's their job to call around to other area hospitals to try and find a bed. Now, that process they've been doing for quite some time now, and it usually only takes a few minutes, but as of recent, it's taking up to hours and sometimes even days. Like a well-oiled machine.
Arkansas Trauma Comm, this is Eddie.
These callers move patients from one hospital to the next.
It's red light, green light. You have availability or you don't.
Now bolts are rusting and the machine that once was is running at less than full speed.
This surge is much more difficult than the winter surge.
Comm isn't getting more calls than it was in December, but with fewer ICU beds available, the problem now is finding openings, even for just one patient.
COVID ICU admissions are higher, and those patients stay in the ICU much longer than a non-COVID patient. Staffing levels are down, so it's the perfect recipe for the perfect storm.
Pre-COVID, the center assisted trauma patients. The wait time from the ER to a bed was about 7 minutes. Tabor says now COVID patients are waiting hours, sometimes days.
Let's just do what you can do with now.
And when they can find a bed, it can take up to 11 hours to get there.
We've coordinated cases from Bella Vista to El Dorado, from West Memphis to Fayetteville, and then all in between.
Tabor says extra beds will help turn these red lights green. But in order to get the machine back to full speed, he says it's up to the public to step up and roll up. Now, Comm says right now the lack of ICU beds isn't really impacting trauma patients, because if you think about it, that's a whole different set of staff. But also coming with the COVID-19 pandemic is staff shortages in hospitals across the state and across the nation. And he said if that continues, then that's when we're going to start seeing issues with trauma patients not being able to get into beds. Live outside of MIMS, I'm Jessica Rank for Fox 16 News.
All right, Jessica, thank you.